Recently, we've talked a lot about football and hockey here in the Tampa Bay area. Now it's time to talk some basketball. Jerry West, NBA legend and 14-time All-Star, joins us today to talk about his career, the start of basketball season, and also a cause that's close to his heart. Atrial fibrillation, aka AFib. I say that a lot better than I did the actual name there. A condition that puts him at risk for a stroke. So obviously thinks about it daily. He's actually joined today by Dr. James Reifel, cardiac specialist. Welcome, Jerry and Doctor. How are you guys today?
Good, thank you.
Well,
very good.
Well, let's first I want to talk a little basketball. Let's talk about NBA Finals. Is it too soon yet to talk about it, or how have you guys been in the off season?
Well, for me, I don't want to talk about it because the Warriors lost, but in many ways, it was a historic year for us. We broke the all-time record for most wins. We're up 3-1 in the finals. Didn't get the job done. My congratulations to Cleveland and their organization for assembling a bunch of guys that wouldn't go away. And disappointing into the season, but the off season has been very kind to us. We were able to acquire one of the truly great players of this era, and he will prove to be one of the greatest players of all time before he retires, in Kevin Durant. And I always thought we had 3 of the top 16 players in the league. I think we got 4 of the top 18 players in the league right now. I've never seen this before, so it's going to be it's going to create a lot of excitement, which it already has, and we're thrilled at the prospects this year.
You know, I am curious. I'm going to use this time to ask you, Jerry, seeing the record-breaking year that you did have, what do you attribute that to, and how does the team make sure and try to carry over that success for this year with the new players?
Well, I don't think it's going to be a big adjustment. Our coach is just going to find more minutes and learn how to substitute the people correctly. But we have great kids. They're not selfish. They'll do a great job, and I think that this is going to be a very interesting season for all NBA fans.
Well, you know, I'm glad we were able to talk a little bit about sports, but we also do want to talk about something very serious, AFib. Talk about your involvement, Jerry, how this was able to change your life and how you're doing today.
Well, obviously AFib is a heart disease, and the most important thing is to be treated for it. I was taking warfarin, which has been around for 60 years. I partnered with Jannssen, and also one of their products I'm taking now, Xarelto, which is a latest blood thinner. Presents a lot of different choices for me, in the sense I don't have to be monitored as closely. I don't have to monitor my diet. Even though I like my doctor, I don't want to go see him once every month or once every 6 weeks. So this has been a great change for me. And if people really want to find out my history, my life with AFib, they can go to myafibchoice.com, and it will tell you all about it. But I think my doctor here will have a lot better answers.
I was going to say, and doctor, he says he doesn't want to see you every day. Obviously, having a little fun there, but this is such a serious issue. How are you able to tell people if they could be affected, or if people need to look into it so that they know that they are at risk or possibly not at risk?
So atrial fib is a common disorder. It can present with shortness of breath, dizziness, fatigue, nonspecific symptoms that should lead you to the doctor. It's common in patients with high blood pressure or diabetes or lung disease. Any of those conditions, you should ask your doctor about atrial fib. And most important in atrial fib is to prevent blood clots that cause strokes. As Jerry said, we used to use warfarin. It's a cumbersome drug. We have 4 new ones now. He's on Xarelto. Much easier for the patient to comply with, and therefore a greater efficacy for the population who take it. Great advances. See your doctor. Talk to them openly about the concerns.
Okay, well, thank you so much, both of you guys, today for your time. We do appreciate it.
Thank you very much.